What if I told you that one of the most powerful tools for supporting healthy blood sugar is sitting in your kitchen right now, costs almost nothing, and is something most people are getting wrong without realizing it? I am not talking about a special supplement. I am not talking about a new device. I am not talking about anything you have to buy, order, or wait for in the mail. I am talking about water. I know, the most ordinary substance on earth, the thing you have been drinking in some form every single day of your life. The thing nobody pays attention to because it feels too simple to matter. But here's what most people, including many diabetics who have been managing their condition for years, have never been told clearly. The way you drink water, when you drink it, how much you drink, and what you replace with it has a measurable influence on your blood sugar control. Not as a miracle, not as a cure, as a quiet, supportive daily ally in the larger work of managing or preventing blood sugar problems. My name is Dr. William L.I., and today I want to walk you through what the evidence actually shows about water and blood sugar. The real biology, the practical timing, the amounts that make a difference, the small daily habits that across years contribute meaningfully to better numbers and a healthier life. By the end of this conversation, you will know something that many people manage their diabetes for decades without ever fully understanding. Stay with me. This is one of those topics where the truth is more useful than any promise could be. Before I tell you the how, I need to walk you through the why. Because once you understand what water actually does in the body of someone managing blood sugar, the practical advice will make sense. When your blood sugar is elevated, several things happen that most people are not taught. Your kidneys, which are constantly filtering your blood, begin to pull excess glucose into your urine. To carry that glucose out, they pull water along with it. This is why one of the classic symptoms of high blood sugar is frequent urination, and why diabetics, particularly when their sugar is poorly controlled, often feel thirsty, even when they have been drinking normally. That fluid loss, repeated across hours and days, leaves the body in a state of mild dehydration. And here is the part that surprises most patients. Dehydration itself raises blood sugar. The mechanism is straightforward. When you are dehydrated, the glucose in your blood becomes more concentrated. Your body, sensing the imbalance, releases stress hormones that further raise blood sugar. The kidneys, struggling to filter under conditions of reduced fluid, work less efficiently, and the result is a cycle in which high blood sugar produces dehydration, and dehydration worsens blood sugar. Drinking adequate water breaks this cycle. It dilutes the glucose in your blood. It supports your kidneys in doing their job. It reduces the stress hormone response. It does not by itself lower blood sugar in the way that medication does, but it removes one of the quieter factors that pushes blood sugar higher than it needs to be. This is the foundation. Hydration is not a cure for diabetes. It is part of the supportive environment in which your blood sugar can be managed more effectively. Are we together on this? Then let me walk you through how to actually do it. The first thing I want you to understand is when to drink water, because timing, in the case of hydration and blood sugar, matters more than most people realize. Start with the morning. When you wake up, your body has been without fluids for several hours, and your blood is more concentrated than it has been all day. This is one of the reasons why fasting blood sugar can sometimes read higher than expected, even when you have not eaten anything. Drinking a full glass of water within the first 30 minutes of waking, before coffee, before breakfast, before anything else, helps reset your hydration status and supports the kidneys in clearing the overnight accumulation of waste products. This single habit, practiced consistently, is one of the easiest changes I recommend. A glass of water on the bedside table the night before, ready to drink when you wake up, is all the setup it requires. The habit, once established, becomes automatic. Continue through the day in a steady pattern. The pattern that supports blood sugar best is not large amounts of water in a few sittings. It is moderate amounts spread evenly across the day, 6 to 8 ounces every hour or two, depending on your size, your activity level, and the climate you live in, is the rhythm most clinicians recommend for adults trying to maintain healthy hydration. A useful trick is to keep a water bottle visible at all times, on your desk, in your car, next to your reading chair. The visibility matters more than people realize. Out of sight, water gets forgotten. Insight, it gets sipped. Drink water before meals. This is one of the practical strategies that has the most evidence behind it for blood sugar support. Drinking a full glass of water about 15 to 30 minutes before a meal does several useful things at once. It fills part of your stomach, which can reduce the total amount of food you eat. It supports the digestive process. It helps moderate the blood sugar response to the meal that follows because the body is starting from a better hydrated state. And in studies of people trying to manage weight and blood sugar, this simple practice has been associated with meaningful improvements over time. Drink water during meals, but in moderation. Some older advice suggested avoiding water with meals to protect digestion. The evidence has not supported this. Moderate sipping of water during a meal is fine, and for many people it is helpful for blood sugar regulation. Avoid drinking large quantities at once, which can dilute the digestive enzymes and feel uncomfortable. But a glass with your meal is generally beneficial. Drink water in response to activity. If you exercise, you lose fluids through sweat and through breathing. Replace them. A glass of water before a walk, sips during the activity if it is long, and a full glass afterwards supports both your blood sugar and your overall recovery. Drink water when you feel hungry between meals. Many people, particularly those managing blood sugar, mistake thirst for hunger. The mechanism is not entirely understood, but the practical reality is that a glass of water consumed slowly often resolves what felt like hunger within 15 to 20 minutes. For someone trying to manage weight or avoid blood sugar spikes from unnecessary snacking, this small habit can be remarkably useful. End your day with water as well. A glass of water in the evening, an hour or two before bed, supports the overnight hydration that influences your morning blood sugar. Avoid drinking large amounts right before sleep, which will interrupt your sleep with bathroom trips. A modest amount an hour or two before lying down hits the right balance. Now, let me talk about how much. The general recommendation for adults is roughly 2 to 3 liters of total fluid per day, which works out to about 8 to 12 cups. This number includes water and other healthy fluids, and it varies significantly based on your size, your activity level, the climate, and your specific medical conditions. For someone managing diabetes, the right amount is often slightly higher than the general recommendation because of the increased fluid losses that come with elevated blood sugar. But there are limits. Drinking enormous amounts of water in a short time is not helpful and can occasionally cause problems with electrolyte balance. The principle is steady, adequate hydration distributed across the day, not heroic amounts consumed all at once. A practical way to monitor your hydration is to pay attention to the color of your urine. When you are well hydrated, it should be pale yellow, close to the color of straw. When it is dark yellow or amber, you are dehydrated and need to drink more. When it is essentially clear, you may be drinking more than you need, which is rarely harmful, but suggests you can ease off slightly. This simple check, performed casually throughout the day, is more useful than counting glasses. If you have heart failure, kidney disease, or certain other medical conditions, your doctor may have given you specific fluid restrictions that override the general advice. Please follow their guidance because those conditions change the calculation significantly. For most healthy adults and for most people with well-controlled type 2 diabetes, the steady moderate hydration pattern I have described is the right approach. The next piece of the conversation is in many ways the most important. What you replace with water matters at least as much as how much water you drink. A person who adds 2 extra glasses of water to their day while continuing to drink 3 sodas, 2 large sweetened coffees, and a glass of juice with breakfast has not improved their hydration in a way that supports blood sugar. The other fluids are doing significant damage that the water alone cannot undo. The single most powerful change you can make in your beverage choices, if you are managing blood sugar or trying to prevent type 2 diabetes, is to replace sugars W sweetened beverages with water. Sodas, sweetened iced teas, fruit-flavored drinks, sports drinks, energy drinks, sweetened coffee drinks loaded with syrups and whipped cream, smoothies with added sugar, lemonades. Any beverage that contains added sugar in any form produces a sharp rise in blood sugar that, repeated daily across years, contributes significantly to the development of diabetes, and to poor blood sugar control in those who already have it. A single can of regular soda contains roughly 9 to 10 teaspoons of sugar. Drinking one a day, every day for a year, delivers more than 30 pounds of sugar into your bloodstream that would not otherwise be there. The metabolic stress of this pattern, sustained across decades, is one of the most significant drivers of type 2 diabetes in the modern world. Replacing sugar-sweetened beverages with water is one of the most impactful single changes a person can make. The benefit is not subtle. People who make this single change consistently see improvements in their blood sugar, their weight, their energy, and their overall metabolic health within weeks. What about diet sodas and other artificially sweetened beverages? This is a complicated area where the evidence is still evolving. The clearest answer is that they are better than regular sodas in terms of immediate blood sugar effects. They are not, however, equivalent to water. Some research has suggested that artificial sweeteners may have effects on the gut microbiome, on cravings for sweet foods, and on long-term metabolic health that are not entirely benign. For occasional use, they are a reasonable transition tool. For daily long-term consumption, water is a better choice. What about fruit juice? Even though fruit juice comes from a healthy food, the juicing process removes the fiber and concentrates the sugar. A glass of orange juice produces a blood sugar response very similar to a glass of soda. For someone managing blood sugar, whole fruit is a much better choice than fruit juice, and water is the best beverage choice in nearly all cases. What about coffee and tea? Both are generally fine for people managing blood sugar as long as they are not loaded with sugar and cream. Plain coffee and unsweetened tea actually have some evidence of supporting blood sugar control, particularly when consumed as part of a broader, healthy pattern. They do contribute to your daily fluid intake, though caffeinated versions have a mild diuretic effect that should be balanced with additional water. Alcohol is another category that requires careful thought. Beyond the cancer and cardiovascular concerns we have talked about in other conversations, alcohol affects blood sugar in complicated ways. For diabetics, it can produce unpredictable blood sugar swings, sometimes raising it sharply, and sometimes causing dangerous drops. If you drink, please do so thoughtfully, with food in moderation, and with full awareness of how it affects your individual blood sugar response. I want to take a moment now to talk about something that is often overlooked. Water alone, drunk in a pattern that does not support overall health, will not produce the benefits we have been discussing. Hydration works alongside the other choices you make. The diabetic who drinks plenty of water but eats ultra-processed foods all day, sits motionless for 14 hours, sleeps poorly, and skips their medications is not going to see meaningful blood sugar improvement from hydration alone. But the diabetic who drinks water consistently, eats fresh whole foods, moves regularly, sleeps well, takes their medications as prescribed, and monitors their blood sugar carefully will find that hydration is one of the small but real pieces of a larger picture that produces real improvement. This is the honest version of how diabetes management works. There is no single trick. There is no single beverage. There is no single food or supplement that solves the problem on its own. There is a pattern of daily choices sustained across time that together produce outcomes far better than any single change could achieve. Water is one piece of that pattern. It is not the whole picture, but it is a meaningful piece, and it is one of the easiest pieces to get right. Are we together on this? Now, let me tell you about a patient I will call Mr. James. He was 60 years old, a man who had been managing type 2 diabetes for about 8 years when he came to see me. His blood sugar control had been mediocre throughout that time, despite his medications and his best intentions. As we went through his daily habits, one thing became clear. He drank almost no water. He drank coffee in the morning loaded with sugar and cream. He drank a soda with lunch. He drank sweetened iced tea throughout the afternoon. He drank a beer or two in the evening. By his own admission, plain water rarely entered his day. We did not make dramatic changes. We did not eliminate everything he loved. We made small, gradual shifts. He kept his morning coffee, but cut down the sugar over several weeks. He replaced the lunchtime soda with sparkling water with a slice of lemon. He moved from sweetened iced tea to unsweetened iced tea with just a splash of lemon. He drank a full glass of water before each meal and another before bed. He kept the evening beer, but only on weekends. Within 3 months, his hemoglobin A1C had dropped by nearly a full percentage point. His energy improved. He lost some weight without trying. He told me the last time I saw him that he had not realized how much of his metabolic stress had been coming from the beverages he was drinking. I am not telling you this story to suggest that water alone fixed his diabetes. It did not. His medications, his other dietary changes, his overall pattern, all of these contributed. But the hydration piece, simple as it was, played a real role in the improvement he experienced. That is the offer I am making to you today. Not a miracle, a practical, useful, supportive practice that combined with everything else you are doing to manage your health can quietly help. I want to leave you with a few simple takeaways because I know we have covered a lot. Drink a glass of water within 30 minutes of waking up. Keep water visible throughout your day. Drink a full glass before each meal. Sip water steadily across the hours, rather than gulping large amounts at once. Replace sugar-sweetened beverages with water as much as you can. Pay attention to the color of your urine as a simple guide to your hydration status. Drink a modest amount of water in the evening, ending an hour or two before bed. That is it. That is the entire practice. There is no special bottle, no expensive system, no complicated rules. Just water in a steady pattern, replacing the beverages that quietly harm blood sugar control and supporting the daily work of a body that is doing its best to keep your numbers in a healthy range across weeks and months and years. This pattern becomes part of who you are. And the person who hydrates well, alongside everything else they do to manage their health, is in a fundamentally different position than the person who does not. Has anyone in your life ever walked you through hydration and blood sugar the way we have today? Has anyone explained the timing, the amounts, the replacements in clear and practical terms? For most of you, I would guess the answer is no. If this conversation has helped you, share it with someone in your life who is managing diabetes or pre-diabetes. A spouse, a parent, a friend, the person you know who has been struggling with their numbers and has not yet been given a clear, practical path forward. And tell me in the comments, tell me what beverages have been the hardest to give up. Tell me what strategies have worked for you. Tell me whether you are going to try the morning glass of water practice and come back and let me know how it has affected you. The community in those comments is genuinely valuable, and your experience helps more people than you know. Before I let you go, one final thought. Managing diabetes, or working to prevent it, is not about a single dramatic change. It is about a daily pattern of small, faithful choices that across the years of your life become the difference between a body that is supported in its work and a body that is fighting against itself. Water is one of those small, faithful choices. It is humble. It is unglamorous. It is available to almost everyone in almost every circumstance at almost no cost. And it is in the quiet way that small things sometimes are one of the most consistent allies your body has in the work of maintaining healthy blood sugar. Take what you have heard today. Begin gradually. Replace one sweetened beverage with water this week. Add a glass before your largest meal. Keep a bottle visible at your desk. Build the practice into the rhythm of your day faithfully without dramatic effort. And let the small thing become part of how you take care of yourself alongside everything else, for as long as you are blessed to be doing this work. Everything I have shared with you today is for educational purposes to help you think more clearly about the role of hydration in supporting healthy blood sugar. Every person is different. Every diabetic situation is unique. If you have specific medical conditions, particularly heart failure, kidney disease, or other conditions that affect how much fluid you should drink, please follow the guidance of your doctor rather than general recommendations from a video. If you are managing diabetes with medications, please do not adjust your medications based on dietary or beverage changes without consulting your doctor. The medications are doing important work, and any changes belong in conversation with the clinician who prescribed them. The hydration practices I have described are meant to support and complement your medical care, not to replace it. If you have access to a registered dietitian who specializes in diabetes, that person can be one of the most valuable allies you will ever have in this work. They can tailor the general advice in this video to your specific situation in ways that no general guidance ever can. You are not a chart. You are not a lab value. You are a human being whose body has been doing remarkable work to maintain your health for as long as you have been alive, and whose continued wellness is worth every small, thoughtful act of care you can offer. Thank you for spending this time with me. Thank you for caring enough about your own health and the health of the people you love to listen carefully through a topic that affects so many lives. And thank you most of all for being willing to believe that the small things done faithfully are sometimes the most important medicine of all. Take care of yourself. Drink your water. Live well.